I'd like to introduce Dr. Ronald Hoffman, the founder and medical director of the Hoffman Center, which is New York City's oldest complementary medicine center. He's also host of Health Talk, America's longest-running physician-hosted radio program. Thank you for joining me, Dr. Hoffman.
Hi there.
Could you tell me when you first heard about LDN?
Well, I first heard about low-dose naltrexone back in the 1980s. And this is when I was beginning in practice, and we were confronting a new medical challenge, which was HIV. And we had absolutely nothing to offer on the HIV front. And there were all kinds of articles appearing in some of the gay weeklies in New York City, out of Chelsea and Greenwich Village, with implausible remedies, herbs and rocket fuel, and because there was no conventional treatment. Of course, then there was this belief that if you simply ate a pure diet or took vitamins, that the whole thing would go away because it was the result of taking too many amyl nitrates or partying too hard, so on and so on. And around that time, there was a physician who is named Dr. Bernard Behari, who had a clinical practice in New York City, and he was already well advanced into his career, and he came up with the interesting idea that by using a low dose of naltrexone, which was a medication used to treat drug addiction, that would have a positive effect on the immune system. And he found that by using a low dose at bedtime, that this tended to reboot or stimulate a patient's immune system, and this became very popular on the HIV circuit. He had a whole coterie of patients. Of course, there was no conventional alternative at that time, so people were gravitating towards anything that was plausible, and that's when I first heard about it. I realized, pretty soon that wasn't, a magical cure for HIV, but I might have used it a few times back in the 80s to support patients with HIV, and then along came the drugs. And many patients, who took them early enough, survived. And I actually still have some of those patients in my practice today. They're getting nutritional therapy along with conventional drug therapy. But flash forward to the late 1990s or the early 2000s, is that low-dose naltrexone started to come back into the picture. And at that time, I was treating a lot of patients who had autoimmune problems, and what came to my attention was some initial research that suggested that low-dose naltrexone could help patients with Crohn's disease and a related condition, ulcerative colitis. And at that time I had a lot of patients with those conditions, and I said, wow, this sounds like a benign intervention. Maybe I should revisit low-dose naltrexone. And then doing research, I saw that it was sort of a general immune modulator, that it could be helpful for a lot of different things. And subsequently, I've been using it in a variety of conditions. I use it on some cancer patients. I use it for patients who have autoimmune diseases. I use it a lot in multiple sclerosis, where I have a fair number of patients. And then my inflammatory bowel disease patients get low-dose naltrexone as well.
And have any of your patients reported any negative side effects?
The major negative side effect is the one that is mostly reported, which is that some patients feel a little hyper initially when they take it. It may interrupt sleep, but that occurs infrequently. And also, we get quite a lot on the dream front. Patients have very vivid dreams, and sometimes that's bothersome. It's difficult for them to tolerate because they take on sometimes a nightmarish quality. It happens probably less than 5% of the time.
Mm-hmm. In your experience, what would you say is the average time for LDN to start to work for someone?
I generally suggest that patients just lock and load and take it for at least 3 months. And if they feel that there may be some signs of benefit, of course I do a lot of things with patients. I seldom just put patients on low-dose naltrexone and don't change their diet or give them nutritional supplements. Sometimes we also give them medication. Then we generally suggest that they really consider taking a trial of a year of low-dose naltrexone, at the end of which it doesn't appear to be doing anything, then it doesn't make sense to continue. Some patients achieve remission in whatever the condition that they have, and then they decide that they don't need to maintain the low-dose naltrexone. We don't know if it's necessary for maintenance of remission or if it drives patients towards remission. But, there's a lot of unanswered questions about low-dose naltrexone.
Yes. And what would you say the success rate has been?
I would say that the success rate has been, I have to say it's unclear. It's unclear because I go into treatment of patients with a multifaceted approach where it's a little clearer. One case in particular sticks out in my mind, who was a young man who had Crohn's disease, and we put him on a very restrictive diet, and we gave him some of the right supplements and probiotics for treatment of this condition. And we waited and we waited and we waited, and he just didn't seem to make any progress. He just seemed to be stuck, and also he was getting very discouraged with the diet because it was so, very, very restrictive. And finally I said, look, it's one other thing I'd like to try. Stick to your guns, please. I'm going to suggest that you continue with the diet. I know it's, restrictive and difficult to implement, but let's add this element. And so it was pretty clear that this was the solo element that we added. And in his case, there was a dramatic improvement within, probably 6 to 8 weeks. That he really did seem to be turning the corner in a more dramatic way. And this is probably not just due to chance or due to the cumulative effects of his diet, because he's pretty much doing everything that he did afterwards before. And I got a very, very ecstatic letter from the mother a couple of years ago, just out of the blue. She said, look, I just want to let you know, because sometimes you don't know what happens to your patients. He was really an underweight kid, unable to exercise. He is now 6'1", weighs 185 pounds, is taking on a full course load at the University of Pennsylvania, is a member of the ROTC, which is a demanding physical program. He's running races. I mean, he's really turned it around.
That's amazing, isn't it?
Yeah. So there was a nice illustration that that's what does it. In other cases, I've had sometimes patients can really pin it down to the low-dose naltrexone because I say, look, I can't help you with the things I've been doing. Let's try that. I've had 1 or 2 patients with skin problems like psoriasis say that there was dramatic change when they took low-dose naltrexone. So that, I think it has applicability there. It's worth a try. Does it always work? No, it doesn't. There's a little bit of an unpredictable quality to it because, but I consider it such a relatively inexpensive and low side effect intervention that I'm very comfortable with instituting a trial with patients who don't seem to be better with other measures.
Thank you very much for sharing your experience with us.
My pleasure.